Well, I was reading a health study, and I think it's important. And this one was about cancer, a cancer that destroys men, and it's conventionally barbaric, conventionally treated and diagnosed barbarically. Prostate cancer is one of the most common cancers in men. According to the latest statistics, about 1,800 men get diagnosed with prostate cancer every year in the United States. However, the study says this is common, which I disagree. It shouldn't be common at all. It has a survival rate. Prostate cancer shouldn't be common at all, is what I'm trying to say. It has a survival rate about 86% of those diagnosed. About 2,600 die from this disease each year. Unfortunately, as most conventional treatments diagnose it, and treatment options for prostate cancer leave much to be desired. Conventional diagnosis includes PSA testing, biopsy, which are prone to false positives and carry high risks of side effects. Like most diseases, treatment typically involves drugs, surgery, and or radiation, all which are risky. There are safe, less invasive ways to diagnose and treat prostate cancer and other diseases, however, so men would be wise to investigate the options on any disease, including prostate cancer. There is a number of safe, all-natural strategies which you may be put in prison if you practice integrated medicine. All natural have shown to be effective against cancer, including the ketogenic diet, exercise, and supplements. Most recently, researchers discovered a bioactive compound in the neem plant to have a potent ability to quell prostate cancer. Neem has been used in Ayurvedic medicine for thousands of years, and the ancient Vedas refer to neem as the tree capable of curing every illness. It has been well established that it benefits for your skin and commonly used in personal care products. It's also been used to ease gastrointestinal problems, strengthen your immune system, and as both as a this is interesting, a spermicide and an insect repellent. You should be using that as a spermicide instead of chemically based products. Now, animal research suggests nimbolide, a bioactive compound from the neem plant, may shrink prostate tumors such as 70% and suppress metastasis by 50% when taken orally for 3 months with no noticeable side effects observed. Treating and preventing cancer, prostate cancer, and other cancers require more than a supplement, a neem supplement, or any other supplement. Your diet is vital part of healing, exercise, and other important metabolic optimization. So he's saying exercise and lose weight if you need to. Avoiding toxins is also important. As with any cancer, many of the chemicals that are common in our homes and environment have been shown to increase your risk of cancer. Some of the most common culprits are those that disrupt your endocrine functions. One of the most common ones is bisphenol A and bisphenol S, BPA and BPS. BPA, which mimics the hormone estrogen, has been linked to increased prostate cancer, decreased sperm production, and genital deformation, erectile dysfunction, and stimulation of the prostate cancer cells. Careful of your exposure, because it may be greater than you think. A 2011 study found that simply eating canned soup for 5 days increased study participants' urinary concentrations of BPA by more than 1,000% compared to eating freshly made soup. If you see a conventional doctor, they're going to say you're going to need to get screened for prostate cancer. According to a report at the Institute of Medicine, approximately 30% of all medical procedures, tests, and medications may be unnecessary. Oh, you think after you see how many people suffer from these tests that provide little to no information and cause damage? The American Academy of Family Physicians, AAFP, campaign has also identified more than a dozen procedures that are still practiced, appear to have little value, in many cases do more harm than good, like I said, including the list of this routine screening for prostate cancer using a PSA test. The PSA test tends to result in an overdiagnosis of prostate tumors, many of which are benign and do not actually require treatment. The U.S. spends $10 billion of unnecessary money per year treating prostate cancer. I say the money is necessary, but it's put in the wrong area here. It should be providing in more natural alternative ways instead of the PSA test. Conventional studies suggest that 30 million men who get screened annually, or these studies who get screened annually for prostate cancer, are actually put at risk due to the high risk of false positives. According to the Prostate Cancer Foundation, 30 to 40% of men treated for prostate cancer actually have tumors that would never have caused a problem. They're benign. More than half of older men have other evidence, pathologic evidence of cancer, prostate cancer. So a PSA screening makes little sense. You're just wasting money here. The PSA is a indicator of inflammation, and inflammation can be an indicator of health problems besides cancer. It's certainly not a definitive test. It should not be the sole basis for a decision to do a biopsy, as a biopsy itself can cause even more damage. If you're lucky, you can get an alternative, and for now the alternative's in place. To get an annual digital rectal exam, your doctor can feel your prostate to find out whether it's hard and no, but that's even worse. But because that can cause damage, the best alternative is then getting a biopsy or getting a digital rectal exam is to get a 3D color Doppler ultrasound test first. Anyways, this disease, like many, is not treated correctly. not diagnosed correctly. And the main take-home message this doctor recommends is that you have options when it comes to prevention, diagnostics, and treatment. And rarely is it necessary to jump right into drugs, surgery, or radiation. So don't let the mainstream medical system use fear to rule your decision in this process.